My name is Dr. Aron Katz, and I'm the Director for the Center of Holistic Urology at Columbia University in New York. I'm also the Vice Chairman and Associate Professor of Urology at Columbia. I've been at Columbia University for the past 20 years and have developed a study, the Center for Holistic Urology, which focuses on using natural compounds that are made in the earth that we can study in scientific investigations, and we're using them in our patients with urological diseases. Currently, prostate cancer is the #1 cancer in adult men. Over 200,000 new prostate cancer diagnoses will be made in 2009. Much of that increase is due to the detection of prostate cancer because of the widespread use of PSA, the prostate-specific antigen test. There have been some new recommendations by the American Urological Association which have come out within the past few weeks because of two large studies, one done here in the United States and another done in Europe. These studies were looking at the PSA test, which is a blood test, for screening of prostate cancer. And it was hoped that these studies would show by screening for this test that we would show a reduction in prostate cancer deaths. But unfortunately what we found, at least in the European study, was that there was really no significant change in the death rates in men that got routine screening versus men that got no screening. Currently, there have been new recommendations by the American Urological Association for prostate screening and testing because of some new studies that have just come out, one done here in the United States and one done in Europe, looking at men who got routine prostate screening on a yearly basis versus men that just were followed and got no specific screening recommendations. And what we found, at least in the United States experience, was that there really wasn't any significant reduction in the death rate of prostate cancer patients when men had routine screening versus no screening. And in fact, what we're doing now with prostate cancer is we're detecting so many of these cases, but in fact, many of them probably don't need to be treated at all and can be put on what we call an active surveillance, or what we've termed in our center the active holistic surveillance. And some of the compounds that we'll be talking about today focus on those patients that have cancer or that maybe are concerned about developing cancer, and we can use these natural compounds that we'll talk about to see if we can prevent the cancer or keep the cancer in a cellular arrest and prevent it from spreading and prevent it from leading to the death of the patient.